How are pancreatic cystic neoplasms accurately diagnosed? Imagine trying to figure out what a mysterious lump in the pancreas really is. Diagnosing pancreatic cystic neoplasms involves a careful blend of imaging, fluid analysis, and clinical judgment. The process starts with imaging studies. Magnetic resonance imaging, especially with magnetic resonance cholangiopancreatography, is usually the first choice because it gives a clear picture of the cyst. It shows the size, shape, connection to the pancreatic duct, and whether there are solid parts or internal septations. If MRI isn't suitable, a computed tomography scan with a pancreatic protocol can be used, but it might not be as detailed. Ultrasound is less sensitive for these cysts and is mainly used at the beginning to rule out pseudocysts, which are often related to pancreatitis but not neoplasms. When imaging raises suspicion, say the cyst is larger than 3 centimeters, has mural nodules, or the pancreatic duct looks dilated, doctors often move to endoscopic ultrasound. This technique uses a tiny camera on a flexible tube inserted into the stomach or duodenum, giving a high-resolution view of the cyst. It also allows for fine needle aspiration, where a small needle is used to collect fluid and tissue from the cyst for testing. The fluid collected is then analyzed. Elevated levels of carcinoembryonic antigen in the fluid suggest a mucinous cyst, which has a higher chance of becoming cancerous. High amylase levels indicate that the cyst communicates with the pancreatic duct, helping to differentiate between pseudocysts and neoplastic cysts. Cytology involves examining cells under a microscope to find any signs of cancer or precancer. Sometimes, molecular testing is done to look for mutations like KRAS or GNAS, which can help identify the cyst type and assess cancer risk. Additional advanced tools are emerging, such as confocal laser endomicroscopy, which provides microscopic images of the cyst while during the procedure. While promising, these techniques are still being studied and are not yet standard practice. Blood tests like Ca19-9 and serum carcinoembryonic antigen can support the diagnosis but are not definitive because they can be elevated in other pancreatic conditions. Liver function tests might also be helpful if the cyst causes biliary obstruction. In summary, diagnosing pancreatic cystic neoplasms is a step-by-step process. It begins with imaging to find and characterize the cyst. When needed, endoscopic ultrasound with fluid sampling provides detailed information. Laboratory analysis of the fluid helps determine if the cyst is benign or has malignant potential. Combining all these pieces of information allows healthcare providers to decide whether to monitor the cyst or consider treatment. It's essential that experienced specialists interpret these results to ensure accurate diagnosis and optimal care. Always consult with healthcare professionals for personalized advice, as each case can be quite different.